Hi, I'm Wendy and today we're going to talk about disc pain. Disc pain is one of the most misunderstood back pains that you can get because people don't realise that just as they can push their disc out, they can actually push it back in with some exercises in the majority of cases. So what we're going to do is we're going to look at the anatomy of a disc. We're going to get a spine and we're going to cut it through this way and look down on it. We're going to look at the vertebral body and then the disc area here, the transverse processes and the spinous process. We've got a thing called a vertebral body that looks like this. And then at each side we have the transverse processes. They look like that. And at the back we have the spinal process. That's like that. And they're those little lumps that you feel down the back. And here we've got the spinal canal. In here we've got the spinal cord. And at each level we have spinal nerves that come out. So this is the front and that's the back. And this is where the disc is. And the disc has two sorts of soft tissue in it. It's got the nucleus pulposus, which is actually like a pulpy middle. It's very viscous. And around that you have the annulus fibrosus, which is fibre. And so, whoopsies, the fibre holds the pulp in place. So that's sort of what it looks like. And when you look at it side on, that's your spinous process there. You have a disc like this, and then the next level here, and the nucleus sits like that when you're sitting up straight or standing up straight. Okay? But because we have a life where we sit down a lot, you know, TVs, cars, computers, aeroplanes, like we're sitting all the time in the West these days. So often we're sitting, and when you sit down, it's a bit more like this, where the nucleus actually tracks back in the annulus and sits back like that. So it sits back here. And what happens then is the annulus gets little tiny tears in it because it's always pushed back. And so we get these little tiny tears in the annulus, it gets weaker. And this bit here actually gets sort of stiffer because it's never ever stretched as it's meant to. When we arch backwards, that nucleus, so arch backwards, shoots forwards, and it does that. And you know, when you're doing the push-up exercise, you're trying to do that. And as this is tight here, and this is weak here. And so it's a good thing to do this exercise, but you need to be a bit gentle, believe me, because many people overdo it, and then you end up with all that sort of like inflammation that occurs. I'm just going to show you when you get really bad back pain from this. Maybe one day you cough or you know, bend over and pick up something heavy, and a few of those little tears sort of join up together, and you end up with that sort of bulging out a bit, and then pressing against structures outside, like the nerve, and then you can get it down a particular nerve, pain all the way down that nerve, or you could just get back pain on that side. This here has no nerves, no nervous supply in the disc, and no blood supply. So you can sort of damage your disc as much as you like, and until you get a bulge, you won't feel anything. And so, but one day when you do get a bulge, then you start to get a bit of back pain. And often what will happen is when you sit down and you get up, you sort of feel a bit stiff and gluey when you get up, and it's Now I'm just going to talk a little bit about this nerve, these nerves here. So say you cut through one of those nerves and you look at it, it looks like this, and it's got tiny, tiny little nerves that go all the way in. It's just completely packed with little fibres of nerves, okay? So these nerves, fibres in the middle here, are the ones that go to your foot. And the ones halfway in go to your knee, and the ones at the outside go to your back. So the bigger the bulge, or the greater the inflammation, the more down your leg or down your limb the pain goes. So if it goes all the way to your foot, you've probably done some really severe damage, which is way beyond this little bit of video. Even if it's gone to your knee, you've done a fair amount of damage, and you have to be extremely careful because these bulges can actually rupture. So it can bulge out, and then the annulus can completely let go, and it ruptures and all comes out here. And then you get huge amounts of inflammation. It takes months and months for it to get better. And nowadays they like to go in and clean it up with keyhole surgery, and yeah, but that's a whole nother story. So if it's just sort of pain down to about like your hip, or down to about here, it's a good idea to try this exercise. You can even try it to the foot, but you just have to be very careful, because the important thing with this exercise is the pain needs to centralise. This is extremely important when you're doing this exercise. So when you do the exercise, if the pain centralises and comes closer to your spine, you're doing fine. If the pain actually goes further down your leg, you're to immediately stop. And it's beyond a video online. You can't learn everything online, come on. But anyway, if it centralises, what you're doing is you're actually helping the disc bulge back in, and that's a good thing. So when we're going to do this exercise, it's very important to understand that it must centralise. You don't want to overdo these exercises. They need to be like gently, because you've got a tightrope of mechanical pain, which is the disc bulge, and the inflammatory pain. So you've got those two. If you overdo the exercises, you will cause more inflammation, and it will feel like you're not getting better. If you don't do enough exercises, of course, you won't get better, because the mechanical pain won't get better. So you've got to be a little bit gentle and a little bit really tune in and mindful. Don't just go galloping in trying to fix this overnight. Think about it as a sort of something that's going to do over a week or 2 weeks or a month, depending on how long you've had it. Generally, it doesn't take more than a few weeks. And now I'm going to talk about the exercises. When you do the exercise, if you just have central pain, you do your exercise with your legs straight, and say the pain's off to the right, you place your legs off to the right and do the same exercise. If the pain's off to the left, you place your legs off to the left to do the exercise. I'll show you that in a minute. So if you place your legs off to the right in this case, it means that the pressure is going to go that way to push that back in that way. Say the disc bulge was going this way, the central pressure would do that, and the same for the left. So you're trying to just put some pressure to push that bulge back in the right way. So we're going to just go and show you the exercises now. There's 3 things to consider. You don't go into the pain, you go only to the pain, or just before the pain. You don't want to cause any inflammation doing this. The second thing is the pain must centralise, come out of your leg and up into your back, or at least not change. If it goes further down your leg, you're to stop immediately. And the third thing is just visualise that disc going back in as you do the pumping movement of the exercise. If you have pain that's central, then your legs are straight. And so you come up to the first bit of pain and down, just pumping up and down like that. And as you get better, you'll be able to go higher and higher. If you have pain off to the left, then you bring your legs off to the left, so you're bent like a banana, then ignore your legs and just doing the same sort of thing. And then, of course, if the pain's off to the right, you do the same thing with your legs off to the right. Hi, I'm Wendy, and I've noticed a few of you Wim Hofers have been having some trouble with your backs with the back extension exercise. So I thought I'd just let you know a little bit more about what's going on for your back. Now, most Western people have been sort of like sitting around most of their lives. We were put into school and we're sitting there bored out of our brains in this terrible posture like this, which is actually a bent forward position of your discs at the bottom of your spine and lots of pressure on them. Children weren't really designed to sit around for 6 to 8 hours a day, with TVs and computers and things like that. And so most of us Westerners actually have quite a bit of stiffness in the low back at the L5-S1 area. And so when we start to extend it, it's stiff and it doesn't really extend very easily, and you have to be a bit gentle, which is what Wim talks about.